Honey, I feel awful. Can you please pass me the blood pressure cuff? Oh my gosh, my blood pressure is skyrocketing. Can we go to the physician, please? Hi, I'm Dr. Mildred, a medical doctor at Cloud General Hospital. Let's talk about hypertension. If you have an elevated blood pressure, which is above the normal 120/80, or have recently been diagnosed with high blood pressure, which is consistently over 140/90, keep watching because this is essential information for you. High blood pressure, also called hypertension, is when the force of your blood pushes against the walls of your blood vessels, causing damage to your arteries and heart by making them work harder and less efficiently. It can seriously hurt important organs like your brain, kidneys, and eyes. The longer it goes uncontrolled, the greater the damage. It is the leading cause of cardiovascular disease. In fact, globally, about 1 billion people have hypertension, and about 160 million people in the United States also have it. How can one tell that they or a loved one has hypertension? 90% of people with hypertension do not know that they have the disease because there are usually no obvious symptoms. Symptoms usually do not occur until high blood pressure has reached a severe or life-threatening stage. Over time, the condition can lead to serious complications such as heart attack, heart failure, or stroke, without producing any warning sign. This is why hypertension gets the name silent killer. Do not let your first symptom be a stroke or a heart attack. For the 10% of people with hypertension, common symptoms include headache, shortness of breath, nosebleeds, chest pain, arrhythmias, exhaustion, nausea, ringing in the ear, and poor vision. However, these symptoms are not specific, and they can be associated with the underlying cause of hypertension. Make sure to call your doctor right away if you experience confusion, drowsiness, chest pain, and breathlessness. Medical providers should monitor blood pressure frequently. Directives may be added if the drug does not adequately control blood pressure. Monitor white blood cell biweekly and serum potassium. Lightheadedness can occur, especially during the first days of therapy, so be sure to rise slowly to sitting or standing position to minimize this effect. Report signs and symptoms of infection such as fever, sore throat, or if the patient develops dry and non-productive cough during the therapy. Avoid increasing potassium in the diet and do not discontinue the product abruptly. If you're worried about the cost, the good news is lisinopril is available as a genetic medication. With a prescription from your doctor, you can get from your local pharmacy like Walmart, Walgreens, and CVS for as low as 0.24 cents each, or a 30-day supply for about $7 only. Lisinopril can be taken by mouth usually once daily with or without food as directed by your doctor. It is used alone or together with other meds to treat high blood pressure. Lisinopril is available in a tablet of 2.5, 5, 10, 20, and maximum dose of 40 milligrams. While lisinopril is an effective medication, just like any medication, there are possible side effects to consider such as cough, dizziness, headache, fatigue, and light sensitivity. Fortunately, lisinopril is usually well tolerated. You can take it at night to avoid some of these symptoms. The risk of side effects is minimal, so don't let the fear of side effects put you in danger of what untreated hypertension brings. Talk to your doctor right away if you have severe effects like hypertension, hyperkalemia, vertigo, pancreatitis, proteinuria, neutropenia, and angioedema. Do not take lisinopril if you're pregnant or planning to get pregnant. Do not take lisinopril if you have a history of angioedema or if you have an allergic reaction or hypersensitivity to the medication. There are groups of people who need to be cautious when taking this medication. These individuals include those with hyperkalemia, severe kidney or heart disease, and women who are breastfeeding. Lisinopril should not be administered with anti-inflammatory medications like ibuprofen or Aleve or other antihypertensives or potassium-sparing diuretics. Also avoid lisinopril with foods high in potassium. These foods include banana, orange juice, avocado, nuts, and spinach. When we found we were pregnant, I felt worried because I had just been diagnosed with high blood pressure. We decided to speak with our physician who suggested that I take labetalol. Labetalol, unlike lisinopril, is pregnancy safe for all trimesters. So I listened and I took 1 tablet twice every day. Pretty soon I started to feel well. My heart palpitations reduced and we had an enjoyable pregnancy. Look at me now. After talking with my doctor about my sudden symptom, my doctor prescribed me lisinopril. Right after that, my blood pressure was under control. There was no more headache, no more dizziness in the morning, and then I have more energy to start my day. Thank you, lisinopril. You have a lifesaver. Thank you.
Hi, I'm Charina and I was recently diagnosed with hypertension. I noticed I get easily tired and out of breath, so I went to see my doctor and I was surprised. My blood pressure was 156/110. My doctor gave me lisinopril and it successfully lowered my blood pressure. I started to feel great again and I have absolutely no side effects on lisinopril.
Another medication used to treat hypertension is labetalol. It is used in patients with pheochromocytoma hypertension during clonidine withdrawal and pediatric hypertension. If you're currently pregnant experiencing hypertensive emergency, labetalol might be the right medication for you. It decreases blood pressure without reflex tachycardia or significant reduction in heart rate. Initial dose for adults is 100 mg tablet and may be given with diuretics. May increase to 200 mg twice a day after 2 days. It can also be given through IV infusion. Labetalol can be taken before meals or before bedtime, and if pulse is less than 50 beats per minute, hold dose and notify your doctor. Common side effects are drowsiness, headaches, cold fingers or toes. Adverse side effects are ventricular dysrhythmias, exfoliate dermatitis, hepatotoxicity, and dysuria.